right. Well, I suppose we could get started. It's about 4 after 6. Just want to welcome everybody for attending and glad that you're here. Want to just kind of give an introduction to the ladies who are running the course this evening. I was gonna say afternoon, but I guess it's night now. But they're going to be discussing strengthening caregiver and child relationships, and we're really excited to hear their presentation. I know they worked really hard on it. So with that, I will have you guys introduce yourselves, and then I'll go ahead and share the PowerPoint so we have that up, and then if you guys just want to like let me know when to switch pages and stuff, then we'll work on that. So you guys, whoever wants to go first, feel free to introduce yourself. And
I can take it away. My name is Callie Rossell. I am a children's mental health case manager and CTSS provider, which is a skill building service. So I coach and guide kids to learn coping skills, communication skills, social skills, tools to help them with like following directions. And yeah, it helps them manage their mental health and improve their functioning in various areas in their life.
All right, and my name is Maureen. I'm a therapist here at HDC. I work in the Duluth office in the child and family outpatient clinic. And so I do individual therapy and family therapy with children, adolescents, teens, and then I also work with a handful of adults as well for individual therapy. And then something else is that I'm trained in what's called Triple P, so Positive Parenting Program, and that is parenting classes that I run a series of. We do about 4 a year, and those are 6-week classes focusing on the positive parenting curriculum, which we'll actually share a little bit of information from positive parenting in tonight's program. So those are kind of the hats I wear at HTC.
All right, and I'm Colleen. I'm an undergrad intern, so I go to school at UMD, and I'll be graduating in May. I shadow Callie a lot during her sessions of CTSS and case management, so I've been able to learn a lot about what goes into that and what goes into teaching kids all these different skills that's necessary for them to further develop. And at UMD, I'm on a research lab as well, and we do some research on children's coping skills and coping mechanisms after experiencing traumatic events. So I kind of have some knowledge on that as well. So yeah.
awesome, thanks guys. If anybody has any questions along the way, either raise your hand or you can use the chat and I can allow you to ask your question. I would assume there's time for questions at the end too, if you guys have questions at the end. So with that, I will start to share the PowerPoint and let you guys get going. I just need to make it.
It's up on the, well, there you go, you got it.
I know, it's like I use PowerPoints very rarely, so then when I use it, I was like,
Yeah.
how do I remember that?
Especially when you're on the spot.
All right, well, there you go. Thanks, guys.
All right, so as Jamie mentioned, the topic today is strengthening caregiver and child relationships. And so we'll cover attachment theory and attachment styles. There's 4 different attachment styles and the influencing factors of attachment. And then we are going to move into influencing factors for damaging relationships, which will cover Gottman's 7 predictors, the Are You There For Me model, and the 5 predictable moves during a disconnection. And then we're going to actually have an exercise that we strongly encourage the audience to participate in. So maybe at the end of the slide, we'll just give everyone a little bit of time to go grab a pen and a paper. Then after the exercise, we'll get into repairing attachment. So different strategies for repairing attachment, coping with the 4 horsemen, emotional coaching, and seven elements of trust. And then we'll end today with some resources that are in our community that you can utilize if you would like to strengthen some caregiver and child relationships. And then at the end, we will leave room or leave time for questions as well. Oh, you can go ahead and move to the next slide. Oh, or wait till people get their pen and paper.
Yeah. All right. Yeah, right there is perfect. All right, so I will just hop into kind of getting us started. And if you're still searching for pen and paper, that is no problem. But we just thought that since we're talking about relationships and strengthening relationships, we would start with attachment theory, since attachment theory is something that, predicts kind of how we are in relationships based on like kind of our earliest bonds. So attachment is an emotional bond with another person that can range from child caregiver relationships to romantic relationships. Attachment theorists believe that the earliest bonds formed by children with their caregivers will have an impact on their relationships throughout the lifespan. So this theory was first developed by a British psychologist named John Bowlby, and he and his colleagues believe that attachment is a necessary process in human evolution. So the theory behind it is that it would help to keep infants close to the mother in order to improve chances of survival by receiving food, comfort, and protection. So that theory suggests that we are born with an innate drive to form attachments with caregivers. And so, yes, it maybe started with like our survival, but as evolution continues, they found that it started to predict kind of how we respond in relationships with one another. So through their research, they determined that nurturing and responsiveness are the key components to attachment. And if you would skip to the next slide, Jamie, thank you. Okay, so you may have heard of the 4 attachment styles. And so attachment theorists say that we develop one of these 4 attachment styles within the first year of our life. So there's the secure, there's the avoidant, there's anxious, and then there's the disorganized. And disorganized tends to look like a combination of avoidant and anxious. And so I'll kind of go through some common things that you might see in someone who has one of these specific attachment styles. So with secure attachment, that would likely look like a child who has a positive self-esteem. They have trusting and quality relationships with, peers, teachers, caregivers. They're able to regulate their emotions as well as a child may be expected to. Empathy and respect boundaries. And this typically develops. A secure attachment will develop when caregivers are present and available for soothing distress. And so being present and being available are 2 themes that are going to kind of keep coming up throughout tonight's presentation. So with avoidance, some common behaviors that you might see in a child would be trouble showing or feeling emotions, discomfort with physical closeness and touch. They might refuse help or emotional support from others. And this sort of attachment style typically develops when a caregiver has routinely refused to acknowledge cries or displays of distress or fear, or if a caregiver attempts to suppress displays of emotion by saying things like stop crying or you're being a baby, things like that. That might be a way that emotion is attempted to be suppressed or just not acknowledged. with an anxious attachment. So a child's behaviors might look like difficulty trusting, a fear of abandonment, low self-worth, maybe frequent reassurance that someone cares, or might look really clingy. And this type of attachment style often develops when a child is dependent on an unreliable caregiver, or they experience care-related inconsistencies or abandonment. And then, like I mentioned, disorganized attachment is often a combination of 2 and 3. And so again, that might look like poor emotion regulation, maybe low self-esteem. By being disorganized, they might at times seek extreme closeness, and then reject the closeness and want extreme distance with no kind of middle ground. And again, that develops when caregivers consistently fail to respond appropriately to a child's distress. And so again, with the being present and available, we will talk about ways to improve that as a caregiver, and also ways to improve the way that you might respond to a child's distress. So you can jump ahead to the next slide. All right. So this flow chart here, so influencing factors of attachment, as I mentioned, being present and available also can be rephrased as opportunity and quality. So this flow chart is something, again, that we will go over in different ways tonight. But if we start at the top, I don't know, can you guys see my mouse if I move my mouse on the PowerPoint, or is it just me? Okay. All right, so if you look at the top where it says, is the caregiver near, attentive, and responsive? That is the opportunity. And then if you move over to the right, the quality of your response to them may make them feel secure. Yep, that's right, secure, love, and have confidence, and that impacts their behaviors and the way that they will continue to seek connection. So if we go back to that triangle again where it says, is the caregiver near, attentive, and responsive? And if the answer is no, so they don't have that opportunity, that also affects the quality of their response. And again, their feelings and behaviors will then impact the way that they seek connection. So this is just sort of an intro. We're going to go through this a little bit more thoroughly throughout the presentation, but keep in mind opportunity and quality, opportunity and quality. And you can jump to the next one.
Okay, now we're going to move into influencing factors for damaging relationships. So go ahead and click on to the next slide. We're going to start with Dr. John and Julie Gottman's 7 predictors. This is actually 7 predictors of divorce, but we're going to look at this through a child and parent relationship lens. So number 1 is a harsh start to an argument. So you can actually predict the outcome of an argument within like the first 3 minutes of the interaction. So if it starts off with hostility, aggression, or sarcasm, you are likely to predict that it's not going to end well. Number 2 is criticism. So this is pointing out the child's flaws. So this might look like, you're so clumsy, why don't you ever make your bed? And number 3 is contempt. So this is like criticism times 100. So we're attacking the child's personality and their character traits. So this might look like, you're a brat, you never think of picking up your clothes, you're crying like a baby. With number 4, defensiveness. So defensiveness says, the problem is not me, it's you, and you avoid taking responsibility by placing the blame on the child. So an example would be like, I wouldn't have yelled at you if you would have done what you were told. I shouldn't have called you stupid, but you made me so angry. And then the next one is stonewalling. So this is like withdrawing or giving your child this silent treatment. Or this can also look like ending a conversation before everyone feels like the issue is resolved. So this could sound like, this isn't up for discussion. I don't want to hear what you have to say. My decision's already made. Sorry, my chair is super squeaky. So I'm trying not to move too much. The next one is flooding. So this is an overwhelming amount of negativity from either the parent or the child that leaves one experiencing some physiological changes. Your heart starts increasing, your heartbeat starts increasing, blood pressure might increase, adrenaline pumping. And then the last one is failed repair attempts. So the child or parent doesn't respond positively to one's attempts at apology, humor, or any other means of easing the tensions. Then next slide is the Are You There For Me model. This is based on the work of Dr. Sue Johnson. So this will show us what a quality connection will look like between a caregiver and a child. And it has the acronym ARE to spell out R. Number one is, are you available and accessible? And so this will look like being attentive to your child. The R is responsive. So are you responding to your child? Are you being responsive to their emotional needs? So are you able to soothe them if they're having a challenging time? Or are you able to celebrate with them if they just did something super awesome or they succeeded at something? And then the E is for engagement. So are you asking questions? Are you validating their emotions? Are you expressing empathy towards them? And so we're going to go into the next slide and we're going to take Are You There For Me with us. So this slide talks about the 5 predictable moves when we're in a disconnection. And this is based off of research by Dr. Ed Tronick and Dr. Sue Johnson. So this is a process. These steps are the process that happens if there is a connection that's not being met. So number one, your child might reach for connection. And if the parent is not accessible, available, responding, or engaging, then we move on to number 2, where the child is going to protest. So they're going to push harder for that connection, or they're going to withdraw. And then eventually we move into the meltdown stage. And this is a big meltdown. So think of like a temper tantrum, all of that. And then eventually we would move into the reconnection or repair. So in a healthy relationship, the two are able to come back together and reconnect and repair their bond. And so, excuse me, I have a YouTube video that shows, number one will show the these different stages. And then the second part is going to show how to reconnect and how to repair that bond. So the timestamps are there, Jamie. All right. Cool. Is the video working?
Was the sound not working?
The sound or the like we couldn't see the
You
video
couldn't see it
either.
either. Okay. Of
Yeah.
course I can see it, but I can only see, can just see the video. So, all right, let me see what I can do.
Okay.
Fix it.
It's not essential to the presentation. We can certainly do without if you can't figure it out, but I think it's a really cool visual.
Okay, pause. I stopped sharing, so hopefully if I reshare, I can get the right one. And share. Can you see it now?
Yeah.
Okay. Can you hear it? Couldn't hear it?
No, but it does have subtitles.
Okay.
Oh, of course, there's a ad. Oh, I think this might be the next.
Did it go to the next one?
Yeah.
I was wondering if that happened. I put it on to the. Can you hear it?
Mm-mm. No, I can't. Well, I can do my best to narrate this. I am neither Dr. Sue Johnson or Dr. Ed Tronick, but I will do my best. So you can see here, the mother and child are engaging. She's responding to the child. She's engaged with them. She's available. And at some point during this, she is told to have a blank face in front of her kiddo and not respond, not engage. And so you can see the kiddo picks up on this really quick. And so she uses all the tools in her toolbox to push for that connection or protest for that connection. She points at where her and her mother were pointing at earlier, trying to gain the attention. She's reaching for the connection. You can see some distress happening. And so she's going to protest and push. So this might look like screaming with a baby or screeching. This might be the withdrawing stage. So turning away, withdrawing. And then they have a complete meltdown. So you can see it losing control. And then the next one.
No. 741, right?
Yeah, 740. So as you can see, the mother started reconnecting or responding, which was then able to repair the attachment. So you can pause now, yeah.
And so something to note with that experiment, do you mind if I hop in, Callie?
Absolutely, yeah.
So something to note with that experiment that they did with those children is that their attachment style was already developed. So all of those children in that experiment were at least 12 months of age, which is what, attachment theory suggests is the time that their attachment style is formed, which is why that's a really good example of then how when mom does come back to reassure the child, her attachment is secure and she is soothed by mom's reassurance and representing herself.
I didn't realize how quick that second clip was. So thank you for that. All right.
Do you see the PowerPoint now?
I see the PowerPoint, but I don't see it on the slide. I don't know if it's like
Yeah,
slow.
we just have like the zoomed out version with like slides 1, 2, 3, and 4 on the side.
Okay. There we go. Okay.
Perfect.
Um,
Okay. You want me to take
yeah.
it?
Yeah.
Okay.
Oh, yeah. That's right. We
All
start
right,
with this.
Yep. So this is where we're going to, before we get into the exercise where we asked you all to have a pen and paper, I'm just going to kind of give a little bit of sort of background explanation to the feedback loop, which if you just want to bounce forward once, Jamie, to the next slide. There we go. So this is what we're going to be focusing on, this feedback loop that looks like a figure 8. But you'll see in there that on each side, we've got thoughts, feelings, and behaviors. But there's 2 sides to it. So if you click back one slide, Jamie, to the CBT triangle. Thank you. So the CBT triangle, if you've heard of this at all, is basically the theory that our thoughts influence our behaviors and our emotions, or our emotions influence what we think and then how we act. And so this, if we're just looking at the CBT triangle, like you can apply it to yourself. So if I am having the emotion of, or if I'm having the thought like, I am a bad parent, I'm terrible at this, that will then impact the way I behave as a parent. I might be more irritable, or I might withdraw more from my child, which then is going to influence the way that I feel. I feel really crummy. I feel hopeless about parenting. And then again, this cycle just keeps going along the triangle. See, I knew it. I'm a bad parent. And then my behavior is going to kind of continue to reflect those thoughts and emotions. And so with the feedback loop that we're going to get into is how, so one side is the parent and the other side is the child. And we're going to be looking at how our thoughts, feelings, and behaviors as a parent may impact our child's thoughts, feelings, and behaviors. And in that cycle, then how does our child's behavior influence our thoughts, and so on and so forth. So that's just kind of a little preface using the thoughts, behaviors, and emotions triangle. So we can jump to the next slide again. Thank you.
All right. So we're going to start on the child side. Jamie, if you don't mind just using the cursor to show, yes. So we're going to start with the behavior on the child side over on the, yep, there. So the start of this feedback loop is going to be the reach for connection. So this might look like, Mom, come play with me. Dad, come look at this super cool thing I just found. Or this might look like jumping on the bed when they're not supposed to, or pushing your buttons. And so we have that initial reach for connection, and then we move that down into the parent thoughts, the parent's thoughts. Yep, right there. And so some initial thoughts that you might have is, I don't have time to like go look at this or come play with you. They're jumping on the bed on purpose. They're pushing my buttons on purpose. Those are some initial thoughts that you might have. And then we can move up into the parent feeling. So an initial feeling might be irritated or feeling overwhelmed, a parent feeling overwhelmed or irritated, but maybe underneath both of those emotions, you see, you might feel guilty that you don't have enough time, or you might feel inadequate. And so then moving into the behavior of the parent, you might yell at the kiddo because they're jumping on the bed or they're pushing your buttons on purpose. Or you might completely dismiss the child because they're wanting to play with you while you're washing the dishes. And then so after that, we'll move into the child's thoughts. Some thoughts that might run through the kid's brain are, they never play with me, they don't love me. So some feelings might be anger, but really underneath that anger could, they might feel unloved. And then we go back to the behavior and they might protest or push harder for a connection. And this might be a bigger behavior, like, I don't know, throwing a toy at their sibling, or possibly even a temper tantrum. So you can go to the next slide. And so this is where you'll need your pen and paper. And Maureen, I really liked how you introduced this when we practiced. So I'm going to let you start.
Okay, now I'm trying to remember what I said before. But basically, we're going to be just working through this like in a list, just like you see here, like 1 through 6. So you don't have to worry about drawing the infinity symbol or anything like that. And so we'll walk through it step by step. So we'll just start with, and then so after this is all written out, that's how you would be able to kind of look back at it and see where really it's, you know, number 1 is the triggered behaviors, emotions, thoughts, behaviors, feelings. So you would see where these would fall on the feedback loop, but we're not going to do the loop. We'll start with number 1. And so right now, just focus like on your own reflection of what these different things might look like in your household. And when we're done with this, we would love it if anyone is willing to share and volunteer kind of what reaches for connection and responses look like in your household. If anyone is comfortable with that, that would be great. But we'll walk through it step by step right now. Is there anything that I should add before we get started?
No,
Okay.
That was great.
All right, so we keep saying kind of like that reach for connection. And if you're having trouble identifying what that might look like, a lot of times people will say things like, my kid, they just keep doing this attention seeking behavior. Like, oh, they're looking for attention. And so one way that we try and reframe things is like, reaching for attention or attention seeking can actually be considered connection seeking, right? So if you write down number 1, what is your child's reach? What alerts you that there's a sense of disconnection, that they want your attention? So kind of the trigger to the feedback loop, and like how Callie explained it, you know, maybe it's as simple as like, hey, come play Legos with me, or watch this, or maybe it's something that's a little bit more irksome, like an attention seeking behavior.
And we'll just give you a few seconds here to think of something and write it down before moving on.
And if while we're working on this, anyone has any questions or needs clarification, feel free to just use the raise your hand feature or unmute yourself if you're able to.
Okay, we can move on to number 2. Number 2 goes into the feelings, so the emotion. So what emotions first come up when you feel triggered? What does your body feel like? So you might notice your heart rate increases. So that might mean you feel angry, or you notice that your body is tense. So that might indicate that you're feeling anxious. So think about that first initial emotional response.
Yeah, and so this really can just be one word: stress, anxiety, excitement, whatever it might be. So once you've got that written down, so just as we move along on the cognitive behavioral triangle, what does that emotion lead you to telling yourself? Think, what are your thoughts that you're having? And so we have written on here like your negative inner dialogue. If you are noticing that there is this pattern of reaches for connection that seem to be like resulting in bigger behaviors. So like we talked about those thoughts of like, um, I am terrible at this parenting thing, or like my kid is just so naughty, or I don't have time for this, I'm too stressed, I'm spread thin, I don't have help, anything like that. What is your inner dialogue when, like, as your thoughts that follow up that initial emotional reaction?
And then number 4, what do you do to cope? So this is looking at the behavior. So when you're in this place of disconnection, how do you cope? What do you do? So you might yell, please stop jumping on the bed. I told you this a million times not to jump on the bed. Or if you're putting away the groceries and your kid wants you to play right now, you might completely dismiss them because you're busy. And so what are some of those behaviors that you do to cope with the disconnection?
Okay, so then number 5. So what are the longing and needs? And so this can be like your longing and needs as a caregiver. It can also be what are the child's needs for connection? So what kind of connection are you longing for with your child? And one way to maybe prompt your answer for this is when you look back at your answer for number 3. So if your inner
Number
dialogue,
2. Oh, wait. Oh, yeah. Okay. Number 3.
yeah, yeah. Well, number 2 and number 3, right? So if you look at your inner dialogue that's impacted by your emotions, if your inner dialogue is telling you like, um, or if your emotions are telling you like, I'm feeling stressed, or I'm like sick of this arguing all of the time, that is what the relationship, like that's identifying like a lack of. So maybe a lack of time, maybe a lack of positive interactions, um, maybe a lack of respect from your child. So what is it that you feel like is missing and you want to see more of?
And then number 6 is reflection and accountability. So what do these reactions, thoughts, and feelings, how do those impact your child, and how do they contribute to the lack of connection with your child? So if anyone would like to share any part of their feedback loop or any part of that exercise, we would love to hear it if you are comfortable.
And that being said, the plan is to then also follow up on this of like, okay, what are steps that we can take to change some of the aspects of this loop and repair information that I know about you guys. But one thing I will say in general is that kids really thrive with like boundaries, consistency, and routine, structure, all of that. And so if that is something that you're struggling with, like how do I put up these boundaries? What does structure and routine look like in our life? I mean, I would just recommend maybe like some additional services for yourself and your kiddo. We'll talk about this at the end, but some options that HDC has that are out there in the community, but just for some additional supports for like yourself and for him.
Okay, thank
Yeah.
you.
Yeah, absolutely.
Thank you for sharing.
All right. Well, why don't we, with all that being said, jump into then the slide that says repairing attachment, and we will kind of get into like this whole leading up to repairing attachment. We've talked a lot about the things that we can do as caregivers to kind of where we'll see more problems come up. But so your attachment style is not like, that is not a life sentence. Like the behaviors that you see with those attachment styles, it does not have to look that way forever, because we can, once we start to recognize patterns, we can start to break patterns and change our behaviors. And relationships and bonds can continue to be improved through consistent and quality caregiving. So if you want to jump to the next slide, Jamie. Okay, so here are just 5 kind of, tangible things that this is based off of the Triple P curriculum that I teach or that I facilitate. And so going back to even like your thoughts of yourself as a parent, like having realistic expectations for yourself, like, okay, I'm not just going to absorb everything in one parenting session and then all of a sudden like have all the answers. I can't expect myself to be, there's no such thing as a perfect parent and there's no such thing as a perfect child. So having those realistic expectations as to like where you and your child are at right now, and accepting help and support, and kind of taking things day by day, along with accepting help and support. So taking care of your own needs as well. So think of that saying, like you can't pour from an empty cup. So making sure that you are, if you need time to yourself, are there supportive people in your life that can maybe take an hour here and there with your kiddo, so that you can, meet your own self-care needs, spending time with friends, with a partner. When your own needs are met, it's easier to be patient, available, and calm. And someone just joined us. Hi, Rose, welcome. Spending time together. So small amounts of quality time go a long way. And actually, so short bursts of quality time, but consistently, so daily, goes a lot further, and is more impactful than doing something like really big and special, like here and there. So there's something called like the 3 special minutes. Each day, if you are able to give your child 3 minutes of your undivided attention without any sort of like criticism or talking about rules or anything like that, but really just focusing on them and that bonding time, reading a book together, playing Legos together, 3 minutes a day goes a long way. And with that, talking with your child, showing that you're interested in them, helps them feel good about themselves, and builds their confidence and shows that you are, giving them that opportunity for connection and showing affection. So this looks different based on the age and your child's comfort level. So if you have a teen and you've never really been a hugger with your teen, and all of a sudden you start giving them hugs, they might be like, oh, okay, what's that all about? So starting small, even things like such as sitting together on the couch, high five, pats on the back. But if you have a little like young kiddo, affection in the early years of a child's life really helps forming those secure bonds and that feeling of safety.
So if you remember earlier, Gottman's 7 predictors, okay, there we go. 7 predictors, there were the 4: criticism, contempt, defensiveness, and stonewalling. These are called the 4 horsemen. And so we have ways to cope with these different situations. So for criticism, again, that's when we're verbally attacking or highlighting a child's flaws. A way to stop that anecdote is by talking about your feelings using I statements and expressing your needs in a positive way. So instead of like, oh, you're so clumsy, you spilled your milk, it can be, oh, the milk spilled, I need you to go grab a washcloth so we can clean it up. Contempt, attacking a sense of self with an insult. A way to stop that anecdote is building a culture of respect and appreciation. So we're not pointing out the child's flaws constantly, but we're recognizing their positive qualities. And when they do one of those things, we praise them, we show praise, and we show appreciation and gratitude for them. With defensiveness, you aren't taking responsibility for your part in the situation, and you reverse the blame. And so the anecdote for the way to stop that anecdote is to take responsibility and apologize for it. So I apologize for yelling. I lost my temper. I was wrong. And then the last one is stonewalling. So if you're angry and frustrated and it's causing you to put up this emotional wall, address that by taking a break to go do something that is going to soothe you. And once you are calm, the two coming back together and trying again to resolve the situation. Go ahead to the next slide.
Okay, so emotion coaching. So I guess I'll get more into this step by step, but something that I want to note is that if we go, if we think all the way back to the beginning of this with the 4 attachment styles, a kind of theme there is like when a child is distressed, the way that they are showing distress and the way that a parent responds to their distress can be something that impacts their attachment style. And then that can also impact like the way that they regulate their own emotions if they are able to, appropriately communicate that they are distressed versus if they don't have the tools to communicate that they're distressed. And so that being said, that's also something that pops into my head hearing about like aggression and behavior problems. Oftentimes, like we see aggression in kids because they don't have that like the emotion communication and identification and ability to communicate what it is that they're feeling. So emotion coaching, which is something that is based on the work of John Gottman, is an approach to caring for children which values their feelings while guiding their behaviors, and it encourages healthy emotional development in order to increase their ability to regulate their emotions and then for you as the caregiver to respond appropriately. So this is basically like we are we're wanting to understand and validate your kiddo's emotions or feelings, and saying, you know, all feelings are okay, but it's the behavior or like the response that you have to your feeling that makes the difference. And so there's 5 steps to this. And the first is, first of all, just being aware of what their emotions are. So being responsive or giving that opportunity, being there to see, to understand what their emotions are. So watching their body language, listening while they're playing to find clues about what makes them anxious, scared, proud, or happy. And then also recognizing that your child is learning about emotions by watching you and how you handle your own feelings. So number 1 is just noticing, what are they feeling? And then the next step is recognizing that emotions are an opportunity to connect with your child, especially when emotions can be overwhelming for them and they don't understand why they're feeling the way they are or what to do with that emotion. So you can help teach them how to handle that in a healthy way. The way that you can do that is by sharing your own feelings, encouraging them to talk about their emotions, and telling them that, telling your child that their feelings are okay and offering guidance and sorting out those feelings. So, tell me how you're feeling. Oh, I felt that way too. You can't hit when you're angry, but let's think about other things you can do when you feel that way. So anger is okay. Hitting, not okay. Sadness is okay, but saying really mean things to someone, not okay. So listening with empathy. So encourage your child to share what they're feeling. So tell me what happened, reflecting back to them. So it sounds like you're feeling, frustrated. It sounds like you're feeling angry. And so really just reflecting back their feelings without criticizing their feelings. So you didn't like when he said that to you, that really hurt your feelings. Shows your child that you're paying attention and taking them seriously. And through this, you're helping them, then they are increasing their own emotional vocabulary and their emotion communication. So by naming your child's emotions, is helping them gain the words to talk about how they're feeling. So something you can do is to start naming emotions early, even before your child can talk. Work hard to identify the emotion that they are feeling versus telling them what they should be feeling. So, even if you think it's a silly thing to be scared over, the reality is that their fear is real. So like, oh, you're feeling afraid of that spider. You've never seen a spider like that before. Instead of like, oh, it's just a spider, it's not going to hurt you. Recognizing that those feelings are okay to happen. They're real to the kiddo. And then kind of going back to, so sometimes this not understanding our feelings or not knowing how to describe our feelings can lead to behaviors that aren't acceptable. So setting limits and finding good solutions. So again, that hurt someone's feelings. I know, like, it's okay to be sad, but we don't use hurtful words. So accepting emotions, but still setting limits on inappropriate behaviors. It's kind of the basics of emotion coaching.
There we go. All right, so we're going to cover the 7 elements of trust. This is based off of research from Dr. Brene Brown. She comes up with a great acronym, BRAVING. So without trust, we can't like really truly connect before we can secure an attachment or for a secure attachment to form or remain, our child needs to trust us. So boundaries is essential. When we are clear about our boundaries, then others can respect ours, and vice versa. It's also important that we understand the boundaries of others so that trust is flowing both ways. So my child understands my boundaries and I understand my child's boundaries. And this is like also can be a learning process. What was okay, what used to be okay might not be okay today. So just understanding that those boundaries might change over time. Reliability is when I don't have my notes in front of me. That's okay though. Reliability is saying what you're going to do and doing it over and over again. So this isn't just one thing that you show for your child. This is something that gradually builds over time. And so for accountability, you're taking responsibility for your mistakes. So others trust people who own up to their mistakes. The vault is when when you tell someone confidential or private information, you can trust them to keep it in a vault that cannot be accessed by other people. So this will look like if a child tells a parent or caregiver confidential information, that caregiver is not sharing it with their family, friends, etc. Integrity. So integrity is being courageous instead of comfortable. So doing the right thing and not the thing that's easy. So going back to accountability, it might be really hard to admit that you're wrong to your child, but you're showing that you are choosing to do the right thing rather than what is wrong. So non-judgment, being able to share and be vulnerable without judgment, and vice versa. And then the last one is generosity. So giving your kiddo the benefit of the doubt, noticing or recognizing that they did not, they're doing the best they can. So like if they forgot to make their bed, they didn't forget to make their bed on purpose. You're giving them the benefit of the doubt that they truly just forgot to make their bed. And that wraps up the elements of trust. So we wanted to leave you with some resources that are in the Northland that you can utilize. I'll have Maureen go over Triple P.
Yeah. Okay. Yeah, so this kind of actually wraps up our presentation. And so Triple P, like I mentioned, that is a positive parenting course that I facilitate. We'll have another one starting in January, actually. And that's 6 weeks of a group that our hope or expectation is that you would be able to attend all 6 weeks because the curriculum builds off of each week. But this is something that the aim is to help you as a parent be more confident and manage common behavior problems, reducing coercive or punitive methods of discipline, which can continue to kind of disrupt attachment. So looking at repairing some of their relationship through focusing on positive connection with your child, but there are some actual strategies that we go over on how to manage behavior problems. And so that's something that if you already have an HDC provider, whether it's your own or your child's, you can just talk to them about a referral. Any one of our providers here, whether they be CTSS or case management, ARMS, etc., can make that referral. If you're not a client of HDC or your child isn't a client, all you have to do is call our intake and get set up with services. Before we move on to the next one, I also want to touch on we also just in general offer individual and family therapy here too. So I'm thinking, if your child does have maybe some trauma symptoms, we also have therapists in our office that are all trained in trauma focused therapy that has a caregiver component to it as well. So that might be something to also look into, but I'll let you go on with the next one, Callie.
The next one is parent-child skills or family skills. So this is also offered through HDC. So in order to be in either of these services, your child needs to be in CTSS. So that is the skill building service where we providers coach and guide kiddos to practice coping skills, communication skills, and social skills. So in a family skills session, that looks like me, a provider, helping guide the child through coping skills with like any family activity or family interaction. I've done this through games. I've done this, or I've been a part of like a kiddo doing chores. So how do we respond nicely to a parent when they give you a direction? You don't like this chore. How can we cope with it? What are some choices we have to cope with it and move forward? And then with the parent-child skills, this looks different because the parent has their own provider as well as the child. So the child will have their CTSS provider and the parent will have an ARMS provider. So they both get that support during those sessions to, practice and demonstrate skills that will strengthen the bond between the two. And so you can, if you have a provider, you can talk to them about either of these services. And if you don't have a provider, you can call intake to initiate them.
All right, and then outside of HDC, Superior Counseling is just another clinic in the Duluth area, but they have providers that are trained in Love and Logic, which is a modality that they would use with you as the caregiver, using techniques that enhance the parent-child relationship. So if you are interested in your own services, Superior Counseling, their information is on there. You would just ask to work with a Love and Logic provider. And then we also, another one that is outside of HDC is the Circle of Security parenting classes. And I do believe that Circle of Security focuses on those really early childhood years. But that is offered through St. Louis County in partnership with Community Action Duluth and the public schools. And those again are classes that are designed to kind of care for the mental health of the child and prevent stress between children and caregivers, and increasing, again, your attachment, connection, and communication. So the information to give them a call is right there on the screen as well. So if you want to take a minute to jot down any of those numbers to reach out, you can do that, and we can just kind of, that's sort of all we have as far as things on the PowerPoint, so we can leave that